So now we're going to get into accessory nerve treatment. And the accessory nerve is the most common entrapment in the entire human body. And the problem is most practitioners are very compressive when they treat it, and they don't accommodate for the angle of the spine and the superficiality of the nerve. So you've learned how to find it through that advanced palpation. Now I'm going to show you how to actually treat it. So the key when you're finding that accessory nerve is finding the landmarks in there. And what I'll usually find is what's called the top here. This is called the superior angle of the shoulder. And that's where you're going to find that first landmark and then kind of go across to give you an idea of where it lives, because the accessory nerve lives right around that shoulder blade. It can get caught in all different areas in there. It can get caught in the levator scap. It can get caught in the rhomboid. It doesn't really matter where it's caught. It's where you feel it. Same setup here. Every time you're going to treat in this cervical thoracic area, you're always going to want to have the client bring their arm over just like that. That's going to help everything kind of relax in there. Now with this, when you get in there and do the palpation, you always want to do it when they're under tension. So we don't want to spend a lot of time for that client in that area, but we talked about you have to find this to get this to open up. So it's finding those landmarks. So usually what I'll find is I'll find C7 or T1, and then I'll find that superior angle in there. And essentially, as we go in there, it's going to get caught right in between there. And when it's bad, you're going to feel some of that superficial tension, and that's that accessory nerve, because it comes out behind the ear, comes down through here, and where it gets stuck is right there. And that's where I'm finding that problem in there. And that one is very jammed up. It's going to be very jammed up on anyone that has a ongoing neck problem. So once you palpate that, you're going to bring them out and let them relax. Now, same exact setup when we do our morning routine and we warm up and we do that, same thing with the elbow and the position high. So now you know that it's here. Now the difference here with the accessory nerve is, here with the accessory nerve is when you're treating this area, you're way less compressive than when you're actually treating the erector. So when you're palpating and it pulls tension, it's going to be very superficial. When it's the erector, it's going to feel deep. Now this one right there is where I feel that. Now the motion is exactly the same for the client. They're going to start their head just like this, and they're going to drop in right down the flexion. Now remember, we have to accommodate for the curve of the thoracic spine. And what happens is so many people just go straight in, and that actually jams that nerve up. And when the nerve gets jammed up, it's a very uncomfortable, very non-effective treatment. So we've located where that scar tissue is with our palpation. What we're going to do now is put our thumb just above that. In a chair, treated just like we are. Client knows they're going to go straight into that flexion. This is just going to be flexion, be very controlled and nice and easy, just like that. Find our spot, up like that. We're going to be nice and relaxed. So we're going to step back, and then we're going to go in and approach it just like that. That elbow is high. See how that elbow high? Now I can line that up, and the same thing. So this is the area that's going to back that up in there from what we see. So we're here, and just like that, elbow high, other one there. It's going to be the same thing. You're going to get that depth by leaning in, and this one, little less depth, come out, and then your tension is going to be that slow drop. You're going to go. You're going to feel that nerve pull. And when that nerve is bad, it'll pull right away. And you want to go nice and slow on that. Don't be in a rush, because nerves are a lot different. And if the nerves get inflamed or they pull, you're not going to get an effective treatment. So same thing, you want to reset up each and every time. In here like this. Watch hair too, because sometimes you can pull it. In like that, and you can see my thumb disappears. But I want you to see one where I don't back my thumb up so you can see it. So I get my depth by leaning in. I back out a bit, and then my tension goes down like that. So I want you to see what happens there. But I'm having to work harder when I do that without my thumb really backed up. So your thumb is backed up in like that. Your depth is in straight in just like that. Elbow drops, and you're going to drop in and let it come right to you. And go ahead, go nice and slow. Very good. Now, sometimes what can happen is you have a client that has a lot of inflammation in there and they can't move their head properly. And sometimes in this situation, especially for the nerve, because it's so important in getting an effective treatment, you might have to take control of the head. So I want to show you how to treat that as well. It's not going to be as optimal, but it's still going to get the job done. So you'll essentially be in here just with the one thumb, and you're going to get your depth by pushing in with your thumb and dropping down. And then what you're going to do is you're going to control that motion and have it come over your thumb just like that. Because a lot of times clients have a very hard time doing that motion, and you don't really want to make that nerve angry. So if they can't control their head or they can't move it, they're moving it too quickly, you might have to take control in there, and it's nice and gentle. You bring it back, you get your depth, you get your tension, and you go in just like that. This is not the ideal way, but sometimes you have to do it that way. Now, another thing that you want to do as you're learning and you're getting more precise and better with this treatment is you want to give yourself a little bit of room to make some mistakes and get that tension on there. So a big thing that you'll do is have the client come back in a little bit more of extension to start. That'll allow that to slacken a little bit. It'll give you some time to kind of catch up. So if you're doing some work in this CT region, basically from C7 down to T4, have them start in a little bit of extension. That'll help them go slower through that motion as you open that up, and that can be a little change that you can make as you're getting a little more perfection with your treatment.